Welcome, friend. Once again, one more INI SS results is out, and I'm here to welcome Dr. Avinash, who is. I'm so proud to tell that he's a Marrow student and he got AML rank 2 and CML rank 3. Avinash, welcome, and you're from Karnataka, basically, right?
Yes, yes.
Can you just introduce yourself? Where you did your MBBS and MD and all?
Yes. So I'm Dr. Avinash Ganapule. I did my MBBS from JNMC, Belgavi, Karnataka, and I did my post graduation MD medicine in from AIIMS Patna, and I finished in the end of January this year.
So you just finish your DM, MD, and then the right first INA accessory you should be able to crack it, and that too with AML rank too. So I just first want to congratulate you for your awesome result. And whenever somebody tells me that he's from Karnataka is actually like my second home because I did my MD there in Mysore Medical College. And so, how was your preparations? How was your plan? Whether you were planning for a DM in neuro in the beginning, or you were just going through MD days, and at the end you realized what you want to take. How was your planning through the entire MD process?
So actually, like I was a bit confused between. I was interested in two subjects more than the others, like neuro and cardiology. So it was more difficult to leave one of the subjects, sir, actually, rather than choose one, because medicine in overall also it is so interesting. Like I delayed a bit too much. I would not advise people to take so long. Like till the end of my MD, I was still a bit confused. But in the end, I decided neurology. But it was like at the end of MD almost. So that was there, sir. But my preparation actually, like in almost in second year, for us, Marrow had started the videos and the SS plan, sir. So I had seen all the videos which were there, which were clinically important. All those videos I had seen, sir, and it was very useful. And but some of the videos, like the pediatric ones, and some of the ones which we don't see in medicine that much, those videos I hadn't seen like in my MD. So immediately after, in the next 1 month, I finished those videos, and after that I started revising 2-3 times. I revised, and that was possible. So my
And
primary, yeah.
yeah, tell.
So no, my primary source was Marrow only because, like over the basic understanding, it improved my understanding a lot actually of the subject, and it increased the like the
That is
interest of.
actually what we aimed also. Like you need to have a better understanding because that is the same thing I used to tell in all interviews or all pre-sessions also. Because the exam pattern, exam questions may change, but the subject as a core is not going to change. So if you have the proper understanding of the subject, you can answer at least majority of the questions, whatever it may. There will be some questions out of the focus, there will be some difficult ones. This exam also had some difficult ones, which even I don't know the answer properly. So that things will come, but majority of questions you will be able to answer. And actually, it is a good thing that you were not able to decide initially because uh, I suggest that it is better to love medicine first, then go for DM because medicine is a core. Whichever subject you are going to take. I think I had repeated this in the last interview also. Like one of our HOD was said, he used to tell, I mean, our unit chief was said, he used to tell that all super specialties are actually subspecialties of medicine. In fact, it is correct. Medicine is a core and basic. Then you can go to the other specialties. And how much, how what was the preparation for your MD exam? Because MD exam was very near, like in January, right? So whether during that time, whether you're preparing for MD parallelly with you're preparing for or SS or and what was your plan regarding INA bar NEET? Whether you're considering INA first, NEET first, or preparing both together? Any difference in preparation for that?
Yes, so actually, in my MD, this thing I'd seen a lot of the videos of the neuro part and the cardiology part also. So I liked them a lot, and even some of the other subjects also I had used Marrow. Like in some of the things where I had difficulty understanding, like some of Rakesh sir's lectures and some gastro lectures also I had seen because they were helpful to increase the understanding whatever I could not understand from Harrison, like some of the things. So it improved, like inculcated the super speciality books also as well as the Harrison together. So it was very useful in the like MD preparation also. So I'd made notes together, combined like Harrison or up to date and like with Marrow. together. So all these three things together, I had made some notes. So that was very useful for the MD preparation part also, sir.
So your primary preparation also is outside Harrison or textbooks was Marrow. So
Yes, sir.
how did you tackle the MCQs? Whether you're doing regular MCQs or just understanding subjects, going through some MCQs, what is your pattern? Because there'll be two patterns. One person or one group of people will follow MCQ based learning, another people will be theory with along with some MCQ. Which was the pattern you followed?
So actually, till my MD was done, I was just focusing on the theory and the understanding and the case-based learning. But later, I understood that for most of the almost half of the questions might be direct, but the remaining half of the questions they won't they'll be in your notes like some other option. They'll have some clues, but they won't be direct questions. So unless you have familiarity of study, like doing a lot of MCQs, then only you'll get that. Without just knowing 50% of the things, you can still not guess, but educated, you can get the best possible answer. So after solving many tests, I realized that I have to do more and more MCQs. So last 2 months, every day I has to do 2-3 hours as to give for MCQs, and I did that retrograde learning in the last 1 or 2 months. Before that, it was just mainly for the MD part, sir.
So you got like last time was you wrote the INA, and
Yes, sir.
actually you were confused between cardio and neuro. So
Yes.
ultimately, what made you think of neuro, or what is the reason why you like neuro?
Yes, sir. Sir, few things were there. Firstly, it is very logical, but again, that was also for cardio. That's why I like these two subjects. But I also wanted to get a bit into research and also a more interest in the diagnosis part than just the intervention part, sir. So I thought more it is more a bit more interesting. The cases used to be very complicated, and that was always interesting to read more and more for the cases to try to get some clue for the diagnosis. So it was very clinical has a very important role to almost reach the diagnosis. So that was very interesting, sir. So, and also
Even
your so the way you had constructed the videos also was very stimulating. That was also one of the reasons which helps, sir.
think actually it is actually lucky for me that some of you people like actually I feel like you people are much better people because you are getting awesome ranks in exam, and if I can inspire you a little bit or even a 1%, I feel it very proud for that. And what was your plan if suppose you are not going to crack INA, you will be preparing for net NEET or you will be waiting for next INA? What was your plan ultimately? Because you are
Uh,
basically from AIIMS.
Yes, sir. So this time actually I was pretty confident because I did not keep a plan B. I was like if I don't get, then I will think about it, because previous times in my UG and all I had a backup, I'll take this if I don't get like that. This time I was because even in the practice tests and all, the Marrow tests were very useful. That increased the confidence. I was getting in the top one or one two ranks like that only. So I thought this time I can get at least in the top 5 or 10. So I was not keeping a backup. I was after that we'll see. If I don't get, we'll see. I was thinking that I will get in the top 5 or 10 at least. I was hoping at least.
Yeah, that is actually a very good confidence, and actually you need that because especially when you are going to write an exam with less number of seats, if you
Yes.
keep a backup in the mind, you will feel more lazy. You will feel like, okay, if it is not that I have another choice.
Yes.
And that was it is a short span of time. It is actually easier to study in a short span of time rather than studying in entire 1 year. 2 or 3 months is actually most useful. And there were other subjects also. You are writing for neurology, but there are other subjects. Medicine was there, cardio, gastro, nephro. So how did you manage all those things? You have one area where you have the medicine and other subjects also will be asked. So how did you manage that preparation?
Sir, earlier, as I said, sir, for the MD part, I had notes prepared already, and but that time that new Harrison edition was not released. So what I did was I was just quickly browsing through the new edition to see if any extra points are there, and I marked those. And my notes, whatever I had, I just spent 1/4 of the time, whatever I 3/4 of the time I was focusing on neuro, and 1/4 of the time or 1/3 I was of the day I was just revising these things. because we cannot predict, like I thought we cannot predict where we'll get the easy questions. So if the medicine part is easy and I miss out some easy questions, that will be a problem. So I thought I should stay in touch with that also, because in some of the initial tests I was forgetting what I already studied for the MD. So I kept like 1/3 or 1/4 of the time for that also, just like some of them from neuro, some of them from Marrow, and some from Harrison notes and all I had. So that I did.
So you were actually daily you were devoting a small amount of time for revision.
Yes.
Right. That is actually a good strategy, because revision is the most important one. Otherwise, you will forget things because it's too much volume of things to remember. Neuro only is very huge. Medicine is again so huge. You cannot study individual all subject. You cannot concentrate on 2, 3 subjects. If you want to concentrate cardio plus neuro, it is almost impossible. But either concentrate on cardio or neuro, because you cannot study both subjects along with medicine. You study medicine plus one subject. That is the only thing possible.
Yes.
And what about the Marrow test series and videos and the your the question discussions and recall? There are 4 things. One is recall sessions, one is video sessions, and one is Q bank, and fourth thing is test series. And we also had a we have discussed about 10 hours MCQ initially, like some topics we have discussed. So how was the out of the 5? How did you felt which one is better, and what are things you prepare? You are going through all of this, or
Yes, I think I finished almost all of them. Yeah, in during the MD part, whatever I had done, that was like already revised and studied for many cases, so that wasn't a problem. Just some of the cases we do not see, I finished those early. And Q bank every day I has to give like 2 hours or 2.5 hours. Neuro plus some medicine, few MCQs also if some topics I was bad at. And mainly I focused on the weak points in the tests, sir. Like I could get like which areas I have some lacunae and all. Used to, you can get to know that thing, one of the advantages. And the second thing was time management also was improved because of the tests. And also because of the tests, sir, the guessing, and not just guessing but like eliminating options and like going to,
logical guessing?
yeah, so even because like some of the questions, like they'll be there in the notes but not like direct questions, like you can eliminate some option based on the logic you have, concept you have from the notes. So like that it was very useful, like together with the notes plus the MCQs, that improved that guessing and that ability also. So that was very useful. So
So you have a lot of videos and 19 modules in Marrow in Euro. So which are the module separately? Like you have epilepsy, you have stroke, you have small vessel, you have headache, not small vessel, you have muscles, nerves, headache, like that. So which module did you like, as well as which is your favorite area?
yes. So like during my MD part, like especially the stroke part was like very good, like that like localization and all, it was so logical that it that made me more interested in this. But the areas which were sort of weak and which improved a lot were like epilepsy was like one of the weak points. I couldn't understand seeing all the EEGs in detail, like could not understand much. But once you had like told about localization and all of those things, like I got almost all of the questions related to EEG in the exam also. And apart from that, so the approaches part actually was very useful. I don't think anyone should skip those, of all the like approach to neuropathy, approach to myopathy, like that. Those videos, like they make the rest of the this thing very easy, sir. Like those were very good, sir, the approaches by videos.
And epilepsy is actually one area when you are doing your MD, you don't have much exposure to. And even when I was doing my MD, I don't have much exposure to. And that is why when you start epilepsy, if you take Marrow and or your textbook and read from epilepsy beginning, it will be tough for you unless you have the basic concept why this is happening, from where this is happening, what are the symptoms, what are the parts. Otherwise, this will be totally confusing. That was why the epilepsy has become a little bit, the length, the volume of the class is also a bit higher than expected. I wanted to make it shorter, but after taking each session, I felt like this won't be understandable to the students, so I want to make it more palatable. That happened before that class. And so I think you probably, because all those people who enter into AIIMS, majority will go into some postdoctoral fellowships. uh, at the end of your DM, you will take some so further specialization in the neuro, like epilepsy or muscle or movement or stroke. I hope you may either turn into an epilepsy or stroke, because stroke is also very much proactive in AIIMS.
Yes.
One of the uh, great professors, great teachers in stroke, and great persons who created the Indian Stroke Association and guidelines. Everyone is from AIIMS. One of the sir was our examiner also. So Rohit Bhatia sir. So so that will be very great for you. And uh, so how do you feel now, and how is your family? Everyone, who are there in your family? I didn't ask that.
So actually, both of my parents are doctors, sir. My father is a general surgeon, and my mother is a gynecologist.
Okay.
So, because of them, I was inspired to get into the medical field. After that, it's a bit different.
So they all very very happy and proud for you because anyway you are there in the AIIMS partner. Now you are going to AIIMS Delhi probably, right? So all the best, and hope you will become a great neurologist, because you definitely will be, because you are entering to AIIMS with flying colors. Study well further, keep the spirit up, and you will definitely will become a great neurologist. Be like what you told, like always be a better clinician than a bookist. That you are telling the clinical things were making you more interesting. The neuro is always about the clinical. That is what I always felt, because this values, percentage, all those things are useful only for entrance, not for practical purpose. So all the best. Happy to talk with you. Very nice to talk with you.
Thank you so much, sir. It was very useful, sir. Like all of your
Thank,
videos was very inspiring, sir. Thank you so much for inviting.
thank you so much. If I can inspire at least one person, that I felt really lucky for doing that.
Thank you, sir. Thank you so much.
Thank you.